الرحمن الرحيم الحمد لله رب العالمين وصلى الله على نبينا محمد وعلى آله وصحبه أجمعين وبعد. Many have asked about how to be positive in the current situation of this increasing number of people being affected by this disease of coronavirus, and also the increasing number of death. In fact, this has created a huge concern and fear among people, which is natural. Fearing this kind of thing is not something unnatural. We are all human beings, and this is something we all experience. How we should deal with this kind of situation is twofold. One is to be, and both are basically information, knowledge. Ilm is light, knowledge is light. It shows you, make things easy for us to find our way in difficult situation. But there are two aspects to that. One is to know about the illness, whatever knowledge Allah subhanahu wa ta'ala has blessed us with, to be aware of that and to the relevant aspect of that knowledge. And second is to know the deen of Allah subhanahu wa ta'ala, because that is the absolute knowledge that guides us through these matters. But in this recording, I want to address the scientific aspect. This is not a science lecture, but briefly information about this virus and how it works and effect and how it transmits between people, so that we know the relevant points which are useful for practically for us. But first of all, the virus. What is a virus? Virus, in brief, simple answer to that is that this is the smallest living organism known to man, or the smallest organism which affect the human body. And living and non-living is an issue of discussion. They are so small that they cannot be seen with an ordinary microscope, but you have to use an electron microscope and blow them thousands of times in size to be able to visualize. They are very simple in structure. They have a covering. They may have some components on top of the covering, and inside there is only genetic material. The coronavirus is what they call as an RNA virus or beta RNA virus, but we don't need to go into the scientific issue. What is important to understand that it's a very simple structure. You can imagine this as a tennis ball and divide it into three components. The inside of this tennis ball is the simple genetic material, the RNA. The covering of the ball is made of lipids, which is fat basically. And outside the covering, you can see some spikes which attach to the human tissue once the virus is inside the human body, especially in lungs. And this is how it is able to destroy the lung tissue. Okay, where did this infection come from, and what was the beginning point of this? This matter is not clear. But what the scientists have said is that because this started in a town called Wuhan in China, they said the beginning point was a fish market where they sell live animals. And the same virus is found in bats. So they said this is from the bats. However, it did not come directly from bats. Rather, they said there is an intermediate animal which is likely to be penguin. Once it come into the human body, then the transmission between person to person takes place, and that's how the outbreak of the disease commenced. So we are more concerned with how the disease transfers from one person to another person, because if we know those mechanisms, then we are able to prevent the transmission, or at least reduce the transmission of the disease. Right. So this occurs when a person who has this viral infection, he sneezes or coughs. The main mode of transmission is droplets, which means that when we cough or sneeze, some droplets come out which contain millions of these viruses. So either a person is in the vicinity where a person coughs or sneezes, so he is likely to inhale these droplets and infect himself, or a person sneezes or coughs and the droplets fall onto surfaces like tables or handles or doors or whatever, and then you touch it, and then you touch your face. This is the way you transfer. So this is why these are the two components of transmission. Number one is droplets which come out of the person who's infected through sneeze and coughs, and number two is the contact, that you touch the surfaces where the droplet is, and hence the recommendation that to have distance between people, so they don't directly affect each other. And secondly, to wash your hands frequently and thoroughly. Here the important point to know is that, as I mentioned earlier, that the virus is encapsulated in a fatty layer, and a layer of fat, and the best thing to destroy the fat is to use the soap, any kind of detergent, household detergent. So if you use that, it breaks that fatty layer, and once it's broken, then the virus is destroyed. This is also a relevant point in washing the dead bodies. Use of soap and thoroughly washing it will not only kill the virus from the body, and also it will prevent it infecting the person who is washing the body. Okay, so having understood that this transmits by touching the surfaces or inhaling the droplets from a person who sneezes or coughs, especially with touching the surfaces and then touching the face, this is the mode of entry, and it enters through three routes, either through the mouth or the nose or the eyes. When we touch our face, these are the areas where it will gain entry inside the body. It will reach inside the mouth, and then from there it can reach into the air passages, and from there into the lung. Once it's inside the air passages and lungs, it attaches to the lung tissue and gain entry into the lung cells. Inside the cells, it grows on the expense of the human cell, multiplies itself into millions, and then sheds off, and then that person sneezes or coughs and throws millions of viruses out, and other people pick them up. This is how the process continues, and the virus spreads in the population. As it uses the lung cells to multiply itself, in the process it destroys the lung cells one by one and leads to what is called fibrosis of the lung, which means, in simple words, the lungs are destroyed and they are not able to perform their normal function of breathing and exchanging the oxygen which is necessary for the survival of the body. And then it leads to various organ failures. So your heart and kidney and brain, other organs are affected because of lack of oxygenation. And this is how usually people would end up in the intensive care therapy. In about 80% of cases, the disease is mild, but in a smaller proportion, it is severe, where they usually present with difficulty in breathing and very quickly progress to the level that they have to be in the intensive care therapy on the ventilator. These are the cases where most death occur. Common symptoms are persistent cough and fever, but they can also have sore throat or runny nose or other flu-like symptoms. Sometimes they have the symptoms related to gut meaning nausea or vomiting or diarrhea. Some patients also have loss of smell or taste or both. And more importantly, that some patients who will have no symptoms, but they have gained this virus, and the virus is they are shedding the virus, so they are infective for other people, but they have no symptoms. But this area is very small number of people, and is still under research to evaluate this further. In the end, we say that this is an illness that Allah subhanahu wa ta'ala is aware of and has sent to us, and Allah subhanahu wa ta'ala has also prescribed treatment for this, which is not clearly known yet. Number of drugs are being under trial. Inshallah, soon we will have a treatment, and then we will be able to deal with that. Until then, we recognize that the treatment is in the hand of Allah Jalla wa Ala. He wishes, He can cure whoever He wishes, even without the use of any medication. These are asbab, means or causes to for achieving something. But the one who makes these means or causes effective is the one who created all of this. So we ask Allah subhanahu wa ta'ala to make this matter easy for us, remove this calamity from us, and cure those who are affected. Ameen ya Rabbil Alameen. Alhamdulillahi Rabbil Alameen.